My name is Megan. I had gastric bypass surgery at Emerson Hospital. I was thin. My friends actually used to have this running joke that they needed to get a fund to feed me because I was so skinny my whole life. My situation was a little unique because I found out when I was over 30, when I was struggling with gaining 10, 20 pounds a year, that I had polycystic ovarian syndrome, which is a hormone issue that causes weight gain and the inability to lose it. I was not built to be heavy. I was never heavy. My body and bones weren't capable of carrying that kind of weight. I had knee surgery on one knee. I was looking at knee surgery on the next knee. I had acid reflux. I had migraines. I had high blood pressure. I had high cholesterol. The more important things of just being able to run after my daughter in the event of an emergency, being able to get up off of a bench and run across the street.
I'm Dr. David Louts. I'm the medical director of the weight loss program at Emerson Hospital. In Megan's case, a big part of her motivation was to be more interactive with her daughter, to be able to play with her daughter, get on the soccer field with her daughter, and she's been able to do that now.
I researched every surgeon who does this in Connecticut, New Hampshire, Massachusetts, and Rhode Island. And I found that Dr. Lautz was the best of the best, and he was very sweet. He was unique because he was very patient and answered every question that I had.
What I did when I came here was to really leverage what I had learned over the last 10 years or so, 10 or 12 years of doing bariatric surgery, to try to create an environment made specifically for these types of patients. From the way the waiting room is set up, to the size of the chairs in the waiting room, to the doorways and the hallways, and the size of the tables in the exam rooms. Little things like that, I think, make a big difference for how comfortable the patients feel.
It was important to me to know that although I was considered a routine surgical patient, sometimes things happen. And I wanted to know that I had a partner on the other side, like Mass General, that if something arose, I had all the best and the brightest at Emerson and Mass General that would be there to get me through it.
If you talk to why our patients want to have surgery, you hear things like, so I can sit in a seat at Fenway, so I can go to a movie theater, so I don't have to ask for an extra seat belt, so I'm not ignored in every conversation, so I can get a promotion at work, so I can play with my kids. And to take patients who have suffered from that their whole life and then give them just a normal body and a normal quality of life like anyone else is a real frame shift. And that's really, I think, the most rewarding piece of what we do.
This means the world to my daughter. I'm able to run with her and play soccer with her, jump with her. I can figure skate with her again. She has a mother that can be involved and not a mother who's sitting on the sidelines because I can't.
Emerson has a great spirit about it. I think it really has. If you walk down the hallways of Emerson, people say hello to you. It's a friendly, welcoming place, and the clinicians are really fantastic, top to bottom. We get a lot of gifts in clinic. Patients are generally pretty happy. It sort of runs from happy to ecstatic for many of our patients.
People do think surgical weight loss is the easy way out, or you have failed in your attempts, or you can do it on your own. But this gives you the option to take your control back. My world was can'ts, and now my world is cans, and I can do anything. I can take on the world.